I retired in 2004, and in May of 2005, after we returned from an extensive retirement trip, 8 weeks, I started to put on weight, and I had a couple of other symptoms that led me to believe something wasn't quite right. And I went to my doctor and was soon thereafter diagnosed with ovarian cancer. At that point, we looked around North America to see where I could get the best possible care for an unpleasant disease with not very good odds. And what we discovered was that in our backyard at VGH, 15 minutes from home, we had some of the best specialists in North America.
While Nancy was going through her treatments for ovarian cancer, I had a physical during the year and had some results that I wasn't all that comfortable with, but postponed really investigating it until towards the end of Nancy's treatments, felt that we couldn't really deal with two issues at the same time. We had a lovely Christmas, and on December 27th, I went back in and got diagnosed with prostate cancer.
January 16th last year, my daughter Katie had a seizure in the Safeway at McDonald and Broadway, and my daughter's mom phoned me and said, get up to Vancouver General Hospital, that Katie's being admitted, she had a seizure. And I went through absolute panic that, you know, any parent goes through when their child's in danger. And I got there and Katie had already been admitted into VGH, into emergency, and was absolutely incoherent. Getting to witness what goes on in emergency firsthand, and we went from bed to CT scan. There is a system, and they're working under absolute shoot from the hip turmoil. All the staff there are totally independent how they're working, yet they're all in this silent team that they all know how each other are integrating, and it just absolutely amazed me.
VGH is unique in the province of British Columbia. Well, actually, it's unique in North America. In most other jurisdictions in North America, there are multiple specialized healthcare centers to look after people with various healthcare needs. But for adults in BC, most of the highly specialized healthcare areas are at this hospital. We are world leaders in the area of cardiac sciences, bone marrow transplantation, complex cancer surgery, prostate care, trauma, spinal cord conditions, adult metabolic diseases, the list goes on and on.
Well, first and foremost, on a day-to-day basis, I look after people. I'm a urologist, and I care particularly for men with prostate illness. That's my subspecialty area. People with enlarged prostates, and mostly men with prostate cancer. The Prostate Center began in 1998 here at Vancouver General Hospital, and we currently have about 130 people on the payroll doing prostate, which makes us one of the largest prostate research-oriented centers in the world. In fact, we're rated now in the top 3 prostate centers across the globe. To be at the cutting edge, you have to do the research, you have to have the state-of-the-art tools to do your research, and you also have to have the state-of-the-art facilities to do the clinical care, to help the men with the prostate illness that we're dealing with on a day-to-day basis. So by having the scientists right next door to the clinicians, and by recruiting people who are both clinicians and scientists, we now have melded those two specialties into one, where we can now develop the science, understand the disease better, develop treatments, and give those treatments to our patients. So men of British Columbia will have early access to some of the great discoveries that we're making in our research center.
As the medical director of the thrombosis program, my responsibility is to develop and build a program that's academic and has 3 components, so clinical care, research, and education. Thrombosis is abnormal blood clotting, and blood is normally designed to flow in the body. And when we cut ourselves, when we get very sick with cancer, infections, or other medical conditions, then the blood will clot. And when this is excessive, it becomes a problem. Often this occurs silently, so patients may feel quite well, have minimal symptoms in their legs, such as a little bit of aching or swelling. If they ignore the symptoms, the blood clots can actually grow, and if that breaks off, it could travel to the heart and lungs, and it could be fatal. So the thrombosis program at VGH is unique to British Columbia. We're the only hospital with a dedicated program to provide timely, efficient, and up-to-date world-class care for thrombosis issues.
I'm a general clinical cardiologist, which is almost a lost art form as we've gone to subspecialty in most areas, including cardiology. So I basically look after patients. I'm in my office, seeing one patient after another, each one of them giving them individual care and trying to decide what cardiac disease they have, if any, and what needs to be done for them. Before you decide that a person needs an angiogram or needs an echocardiogram or a stress test, somebody has to look at the patient, take a history, and make a decision as to what the likelihood is that they have heart disease and what heart disease it is. Our patients require the best that cardiology can offer, and we're only going to be able to provide that if we have the most up-to-date equipment, the most up-to-date personnel, and are able to both retain and recruit new individuals all the time to continue to treat this burgeoning disease process.
I'm an orthopedic spine surgeon here at VGH, and a large part of my practice is in dealing with patients who arrive at VGH with a severe injury to their spine or spinal cord. And at the same time, I spend a lot of my time in my lab, which is just next door, where we study this type of injury with the hope of developing new treatments for that kind of devastating injury. We have thought for many years that there is really a golden opportunity in the very early stages of injury to intervene and effect some positive change in the outcome. Because we know that once the injury occurs, it touches off a series of other injuries within the spinal cord that can make the damage worse. And we feel that if we can understand that process better, we can target it better with treatments.
The physicians that we have wouldn't be here if they didn't have the wonderful facilities for research and clinical care that we have at VGH. And those facilities are provided by our donors. I mean, the government provides the basic care, but the facilities that are provided by our donors allow us to attract the best physicians and surgeons in the world and allow them to provide the superlative care that they do. Because the world of healthcare is becoming more complex, more highly specialized, we need our donors now more than ever.
I'm going to have to rely on my community philanthropists as well as my government leaders to come forward and help us take this dream and make it a reality.
Donors have a huge role in facilitating the kind of work that we'd like to do, the kind of unique bidirectional translational research that we think is really going to make a difference to the lives of our patients.
Knowing that people are out there supporting us and rooting for us really fuels us. It makes us want to work harder, achieve more, and try harder.
I think that, especially given this new economy that we're in, that we can't be embarrassed to talk about giving or participating. And I think that those who can and those who have a Rolodex or a sphere of influence have to keep participating.
Taking the leadership, particularly with VGH in this instance, really makes you feel good. I mean, you're doing good things for the institution, but there is that personal satisfaction, I think, that you get from knowing that you're helping others. We're both healthy, feeling great, living our lives to the fullest, no compromises, and we couldn't have done it without the care that we received at Vancouver General Hospital.